Hello, thank you for joining us for Unite for Sight's webinar about careers in global health and social entrepreneurship. My name is Jennifer Sight, and I'm founder and Chief Executive Officer of Unite for Sight. I'll briefly introduce you to Unite for Sight, review the webinar logistics, and then we'll hear from our 9 expert panelists. Unite for Sight is a global health profit organization that promotes high-quality care for all. And we offer extensive global health and social entrepreneurship education programs. Our Global Health University program offers a free webinar series, including today's webinar, and we also offer 20 online certificate programs for students and professionals. And many students, for example, receive academic credit for completion of our certificates through their universities. And the certificate topics range from a certificate in global health and a certificate in global health research to a certificate in social entrepreneurship. We have a number of upcoming free webinars after today's webinar, which are scheduled throughout February, and we will also have many additional webinars during March, April, and beyond as well. And we encourage you to register for these free webinars at uniteforsight.org/webinars. We have one upcoming on February 12th about tools for designing and implementing effective programs, and another on February 19th about strategies for responsible global health engagement. Additional educational opportunities for students and professionals includes participation in Unite for Sight's annual Global Health and Social Entrepreneurship events, which focus on responsible global engagement, and our 12th annual Global Health and Innovation Conference, which is the world's largest global health conference and social entrepreneurship conference, will be held at Yale University on March 28th and 29th, 2015, so just over 2 months away. The Global Health and Innovation Conference also includes a GHIC Innovation Prize, which is a $10,000 and a $5,000 cash prize that is awarded to the 2 best social enterprise pitches that are presented at the 2015 conference. Both students and professionals and nonprofit and for-profit organizations are eligible to apply for the GHIC Innovation Prize. The Innovation Prize supports outstanding early-stage and startup ideas, programs, and organizations which are locally developed and locally responsible. We also have, through Unite for Sight, healthcare delivery programs that provide care to patients living in poverty. And we partner with phenomenal local eye clinics in Ghana, Honduras, and India to provide quality eye care to patients who are otherwise unable to access or afford care. And these programs are locally led and locally managed by local medical professionals, and our collaboration has provided eye care to 1.9 million patients by local doctors during the past decade, including more than 87,000 sight-restoring surgeries by the local ophthalmologists. Unite for Sight is also the world's only organization that is a healthcare delivery organization that also offers immersive global health education and social entrepreneurship opportunities for students and professionals. And participants support and learn from the local doctors in Ghana, Honduras, and India as they provide care to the patients living in poverty in villages, slums, and refugee camps. Participants then learn from the local medical professionals about patient barriers to care and about effective strategies to reach the hardest to reach patients who are otherwise unable to access or afford care. The local doctors are incredible social entrepreneurs who design effective and innovative strategies to eliminate those barriers to care for the patient. Now I'll describe the basic logistics of this webinar. We're so delighted to have all of you with us today, and we have 9 incredible panelists who have a wealth of expertise to share with you during this next hour. Each panelist will start by giving a 2-minute introduction about themselves, their current role, and their key piece of guidance about a career in global health and social entrepreneurship. We'll then dedicate the remaining time to your questions and answers, and we received many excellent questions already submitted from you, our audience, by Monday's question submission deadline. We selected the most common and most thoughtful questions to ask our panelists. We also invite you to submit additional questions today in the text box on the left of your webinar screen. We'll then select those questions to ask the panelists today as well. We also encourage you to tweet about the webinar, including your key lessons learned by using the hashtag GHUwebinar, and you can see that hashtag in the webinar visuals on your screen. We'll proceed now with having our panelists introduce themselves in alphabetical order. I'm delighted to introduce you to our first panelist, Elizabeth Bradley. Betsy, please begin by introducing yourself, your background and current role, and please share your key piece of guidance about a career in global health.
Okay. Thank you so much, Jennifer. I really am honored to be here and appreciate the introduction and the background on Unite for Sight. As Jennifer Miss Bradley, I am a professor of public health at the Yale School of Public Health. I also run our university's Global Health Initiative, which is a interdisciplinary initiative across the university for diverse faculty and staff and students who want to get involved in all kinds of global health issues, including, of course, issues right here in the United States. My background was actually previously as an administrator, a hospital administrator in the area of health, and so I bring to all the work I do, I think, a health systems perspective and one that really focuses on management, leadership, and governance. Happy to talk about that later. We were given 2 minutes, so now I'll just go directly to words of wisdom or guidance for a global health career. And I think what I would advise is find the thing you love to do and do it. I don't think there is a possible single way to anticipate what the key issue is going to be or anticipate the right place to be at the right time. So best be guided by what seems to bring you alive and allow you to flourish using your best talents, regardless of the particular country or particular disease or particular intervention that might be. And I know that's general, perhaps as a real educator, but that's probably where I would begin.
Thank you so much, Betsy. And Andrea Coleman, if you can also please introduce yourself, your background and current role, and share your key piece of guidance to the audience.
Thank you, Jennifer. I, too, am honored to be here. Thank you. Yes, well, Riders for Health is probably the most peculiar of all your participants this evening. Riders for Health was started because of the background of the co-founders, that's me and my husband, Barry Coleman, is one in the automotive side. I was a motorcycle racer. My husband was a journalist, but also a motorcyclist. And what infuriated us when we first visited the African continent was that women and children were being deprived of the health care they needed because nobody was able to reach them, because the vehicles that are imported nobody's trained to maintain them, that nobody's trained in supply chain or any of the fuel management or any of the very, very boring and bog standard things that really make a health system move. So we dedicated ourselves to that issue, and we are now 25 years into that. So we're just beginning to get some grip on global health. And my advice, I think, would be that I'm going to come at it much more, not so much from global health, but from the social entrepreneurship side. One finds that there's a lot of issues that really are not being addressed. Some of the fundamentals, as you know, this is about transport, and some of the things, very practical things, are not being addressed. So I think you come into it feeling that you need to unsettle the status quo, to do something that's not been done before, to do something and expect a different result. So I would say that anybody starting a career, particularly in social enterprise and global health, should have a notice over their own desk saying, no comfort zone here. It's tough, you have to be persistent, you have to challenge the status quo all the time, but nevertheless, it's worth it.
Terrific. Thank you, Andrea. And our next panelist, Paul Ellingstad, if you can also please introduce yourself.
Hi, thanks very much, Jennifer. So my name is Paul Ellingstad, and I work in, we call it human progress and living progress. It's part of HP where we focus on bringing all of the talent, the assets, the capabilities of the company to address social and environmental challenges. And, my background, I've worked in the IT industry, for my entire career in a range of roles from strategy, communications, marketing. And I think one of the most interesting things and what's so exciting about global health is that technology has become so pervasive in so many different aspects of our lives, both personally and professionally. And, over the span of my career, I've seen the role that technology plays as an enabler to improve the way that we live and work, from communications and entertainment and, virtually every aspect. But, two of the sort of the laggards are maybe in health and education. And so it's been very exciting to see, how we can take the core capabilities and the talents and the resources of our company and work with NGOs and governments and social entrepreneurs to bring, those tools and those talents to bear to make a real, sustainable impact in global health. In terms of advice, I think sort of building on a few things that the others have said, whatever you do, if it's in global health or social entrepreneurship or any other career, first be really true to yourself on sort of your purpose, your interests, and your passions. But I think equally importantly is recognizing sort of the talents and the experience and the value that those talents and experience offer in whatever profession or whatever role that you're in. So sort of finding that sweet spot. The other piece, though, that I think is also really important is that, it's sort of a pretty wild world out there and a lot of people that want to make a difference. So I think being humble and recognizing you're one part of an ecosystem and you have a role to play and then persevering as you work through that.
Terrific. Thank you so much, Paul. And Jordan Levy, if you can also please introduce yourself.
Sure. Hi, and thank you for having me participate. Jennifer, I really enjoy being a part of these, and thank you for all the information at the front. If I have to talk about my background, the most recent 10 years or 11 years I've spent with Ubuntu Education Fund, and Ubuntu is based in one community in the townships of Port Elizabeth, and we work with orphans and vulnerable children, utilizing health, education, psychosocial, and household stability interventions to try to take children from cradle to career and give them a multitude of interventions, very personalized and very customized to the child and to the family, with the hope that using health as one of the core elements that we could actually stabilize the child and the household and give them the opportunity to access whether it's the job market or academics and other possibilities in their life. But what we recognize is that it takes quite a deep intervention. And I would say that, if I have to give advice, I think in terms of careers, knowing yourself and understanding what steps you're taking and where you're heading. I think the term social entrepreneurship is a weighted one, and I think those that are heading towards that career path have to understand the term entrepreneur. And often when we hear this word, we think of the Richard Bransons of the world and those that get a lot of publicity. And those entrepreneurs have progressed quite a bit in their entrepreneurship. And I think my advice is to understand the early days and early years of what entrepreneurship is, social or otherwise. It's tough, and it takes a great deal of resilience. And I think you really need to find the best fit for yourself and what you're sort of looking to get yourself into. To start any startup company, social or otherwise, is going to be very, very long hours. And at the beginning, whether your reward you're looking for is monetary or social or other, you're not going to get that immediate impact and that immediate gratification. In fact, there's going to be a lot of tough times. And I'm not saying that to be discouraging. In fact, I went through all of this, and I'm very happy I did, and really enjoyed coming out the other side and working with a small group of people to do this. But you have to really be in a field that you like. And I would also add, I mean, everybody articulated that already, and I would just add that look around for people you like working with, because you're going to end up spending a lot of time with them if you're in this, like I think almost of the panelists have been, and I think they understand what I'm saying. So it's really something that you're truly passionate about. I think that's great advice, because you're gonna spend a lot of your time there.
Perfect. Thank you, Jordan. And Layla Macarecci, if you can also introduce yourself, please.
Sure. Hi, everyone. It's great to be with you today. I'll give you a really short snippet of my background because I actually do not have a background in health, but ended up working in global health. I studied poli-sci and social welfare as an undergrad, and in graduate school I did a master's of public administration and was really interested in pursuing how to better manage and administer organizations that work in international development, be it health or education or what any issue. I got into this field by way of UNDP, the United Nations Development Program, and actually started working in gender and transitioned over into different topics. And initially, I just sort of put aside my UN career and took a very low-paying job in India to help set up and manage a public health project and realized how much I enjoyed the tangible aspects of health. That is what led me to MicroClinic International, where today I am the Chief Operating Officer and the Executive Vice President for Program Management. And basically in that role, I help oversee the operations of the organization in headquarters and also in our field sites, and get to work with our various program managers and serve as a liaison between our program staff, our researchers who very vigorously evaluate our work, and our policy department, which works with policymakers around the world to scale up our initiatives. The advice or lesson that I've learned in this role and in this field is not to be afraid to do things very differently from everyone else. MicroClinic International operates, I think, in a very unique manner. We have a pretty small team and a pretty huge reach. Our headquarters team is under 10 people, U.S.-based, and our reach in the field is in the hundreds of thousands. So we do a lot of things differently, and it's worked really well for us, and I think everyone really enjoys being a part of the team because we're really not afraid to think outside the box. And I would encourage those who are pursuing this career to also think very differently than how everyone else might be going about things, whether that applies to running your own organization or social venture, or just in your role and how you go about your job.
Thank you, Layla. Fola May, please introduce yourself as well.
Thank you, Jennifer. My name is Fola May, and I'm the Director of Partnerships for SEED Global Health. SEED is a public-private partnership with the United States Peace Corps and PEPFAR, and we strive to improve global health equity by working with educational institutions in resource-poor regions around the world, basically trying to help meet healthcare, human resource, and professional needs. We achieve these goals by focusing on training and education. We focus on training the next generation of healthcare leaders in countries where we've established bilateral partnerships with Ministry of Health and Education. Currently, SEED works in 3 countries, Tanzania, Malawi, and Uganda. These are countries with severely low ratios of clinical providers to populations, but extremely high burdens of disease. We place about 30 to 40 board-certified U.S. doctors and nurses as faculty at educational institutions in these 3 countries each year. Our volunteers formally and informally teach students, house staff, and other learners, and in exchange, we offer education debt repayment stipends to our volunteers. My main responsibility on the SEED team is as the Director of Partnership. In that role, I basically lead discussions with potential U.S.-based partners, whether that be NGOs, academic institutions, private corporations, or professional societies. We try and work with our partners to determine areas in which we can work together to contribute to the educational needs in our partner countries. My background actually is in medicine. I studied Spanish in undergrad and started working actually in Latin America and Central America, and then was able to work in West Africa, South Africa, and East Africa, mostly providing health care, but became very interested in how to build health system infrastructure. We were asked to provide a piece of guidance or advice. Mine's a pretty simple one, but I feel it's one that we often forget. When we enter new cultures, we must always remember that we're the visitors. It's too often that individuals from the U.S. or other developed regions ascend on resource-poor regions with an agenda and surprisingly little insight into what the natives want and need. And I just challenge everyone that as you explore ways to improve the world and find innovative ways to help people, keep foremost in your mind that we are not always the authority. Embrace the culture, learn the language, understand the shortcomings and the needs, and most importantly, work with those efforts to best most effective ways.
Wonderful. Thank you so much, Fola. And Barrett Prinz, if you can also please introduce yourself next.
Sure. Thanks for having me, Jennifer. So my name is Barrett Prinz, and I'm the Chief People Officer for One Acre Fund. And we are a social enterprise that works with over 200,000 smallhold farm families in East Africa now, and we provide those families with a market bundle of services, which includes inputs on credit, training on the newer techniques, and market facilitation processes. And those services, which the families pay market rates for, allow them to usually increase their farm profit by about 100% per acre. And we're about 8 years old now and growing very quickly. My job as the Chief People Officer is to kind of work with our staff to recruit, grow, and retain the best international development professionals we could find in the world. And currently our staff number is over 2,000, so we have a pretty big staff. 99+% of those are local hires, so we have a huge focus on finding in-country staff to run the organization. My background is a little bit different. I'm a lawyer by training. I spent about 10 years in private practice in New York, but spent a lot of time volunteering and then transitioned over to One Acre Fund about 5 years ago. I had an employment law background, so that was pretty valuable. The piece of advice I can give folks, it echoes a lot of what was said by prior presenters. Number one, I would find an organization that you are passionate about, because you're going to work a ton of hard hours, not make a lot of money, and you really need to be fulfilled with the mission of your organization. Number two, I'd find an organization that's efficient. Find one that delivers as much impact and value to the recipients in the field, because that's just good practice. And then the last part I would say is get ready to work with really some of the best and brightest people in the world, not just in the nonprofit sector, but really in any sector. I was blown away by the quality of people that I worked with moving from a private law firm into a nonprofit setting. So hope that helps. Thanks again.
Fantastic. Thank you so much, Barrett. And Tali Shmulevich, if you can also please introduce yourself.
Sure. Thank you. Happy to be here. I'm Tali Shmulevich, and I'm the Vice President of Operations at Global Health Corps. Global Health Corps is an organization that's founded on the belief that great ideas don't change the world, great people change the world. And we are developing the next generation of leaders in global health. So we work with leading health organizations in the U.S. and in East and Southern Africa, such as Mothers to Mothers. And these organizations identify talent gaps that they have, and we competitively recruit young professionals to fill those gaps. So the people we select spend a year tackling some of the most complicated global health challenges in the world today. During the fellowship year, we provide a lot of leadership development training, mentorship, and personal and professional support. And we invest very heavily in connecting our fellows and alums so that they become part of a strongly networked community and then can rely on this community for professional advice, job referrals, thought partnership, and friendship throughout their careers. And actually, our fellowship application is open now until February 3rd. So if any of this is sounding interesting, then I definitely encourage you to check us out online. So prior to joining Global Health Corps, I was the Vice President of National Business Development at Phoenix House. And there I had the opportunity to establish Phoenix House's first specialized substance abuse and mental health treatment program for veterans, which was work that was very meaningful to me. And prior to Phoenix House, I spent several years at Public Health Solutions, founding and running Medicaid and food stamp enrollment programs across New York City. I think some wonderful advice has been shared so far. I would add to that I think one of the things that young professionals in global health should be doing, especially early in their careers, is really investing in yourselves. So spend time developing great work skills and good habits early in your career, because those will enable you to be effective in any organization and on any path that you choose to pursue. So by good work skills, I mean the ability to manage time effectively and consistently meet or exceed deadlines, the ability to negotiate expectations if you're put in a role where too much is expected of you, the ability to juggle multiple priorities and deliver work products that are error-free, the ability to follow through on projects to completion, and the ability to ensure that you're getting the information you need to do your work well. I think these are the kinds of skills that form the foundation of a person's work persona in any organization, and I think that being thoughtful about developing them is a really worthwhile investment.
Well, thank you, Tali. And our final panelist, Robin Smalley, if you can also please introduce yourself.
Sure. Thanks so much, Jennifer, and it really is wonderful to be part of such an incredible panel. I'm Robin Smalley. I'm the co-founder and U.S. Director of Mothers to Mothers. And like Andrea was talking about, I came to this path very non-traditionally. I started, well, like most young people that I talk to and probably who are on the line today, I wanted to do something to make a difference in the world. But for me, I thought the best way to do that was through television and media. So I spent most of my adult life as a TV producer, director, and writer. And I did that for a good 15 years, and for a lot of that time it was very satisfying, and I was able to do shows that I did feel provided valuable information and was influencing positive behavior change. But gradually it started to change for me. The shows got worse. I got dissatisfied. I felt like I had lost my way. And I had served on several NGO boards, so I knew that I wanted to do something in nonprofit work, but I had no idea what skills that I would have that were transferable. I had an Emmy Award, but no advanced degrees. And so I did what so many people do who don't know what they want to do when they grow up, and I started consulting for nonprofits. And that was great, and it led me to running an organization called the Media Project, which for me was a terrific interim step, working with writers and producers on issues around adolescent reproductive and sexual health. Africa was not on my radar. Working with HIV-positive mothers also was not on my radar. And then one day my whole life changed. My best friend Karen went in for some minor arthroscopic shoulder surgery and didn't come out of anesthesia. Her brother Mitch, who I'd known most of my life, who was an obstetrician and had been living in South Africa, he came in and he and I sat for 2 weeks while coma. And at that time, he shared with me an idea he had about a peer mentorship program for HIV-positive pregnant women. And Karen ended up passing away. And in my grief, Mitch invited me to visit him in Cape Town, where he was volunteering as an obstetrician. I fell in love my first day. I fell in love with the women that I met, with the joy, the spirit, the courage that they had. I was also overwhelmed by the injustice that we had basically eradicated pediatric AIDS here in the U.S., and yet we were still at that time having almost 800 babies born every day, HIV positive in sub-Saharan Africa. And I called my husband that first day in Cape Town and said, this is something I have to do, and we have to move to Cape Town. And 1 month later, we picked up the kids and the dogs in the house and had moved. And that, for me, became the beginning of a new life in global health, of which I knew very little. And social entrepreneurship, which is a term that I'd never heard of until we, in fact, won the prize for it from the Skoll Foundation. So I became Mothers to Mothers' first executive director. It was an enormous learning curve for me. We started operating out of Mitch's car. In 1 year, we'd grown to 79 sites in 3 countries, and 10 years had gone to 9 countries. Today, I'm back in the U.S. as the director of Mothers to Mothers U.S., primarily leading fundraising, communications, advocacy, serving on the senior management team and on the board. Looking back, I think my greatest advantage was really not knowing enough to be frightened. I didn't know what you weren't supposed to do. I didn't know the protocols. And so as a result, I did whatever I thought would work for Mothers to Mothers, whatever I thought would put it on the map. I came to it with a background as a storyteller and a producer, so that's what I did. I tried to engage people in something I cared deeply about and did whatever I could to produce results. And, boy, everybody before me has given such great advice that I would have given. I mean, clearly, you need to fall in love with an idea, not fall in love with social entrepreneurship. You need to believe in it with all your heart. You need to get others to believe in it. You need to make sure there's a need for it. We have too much reinventing of the wheel. Remember that it is really hard. I tend to think people think it's glamorous. They're going to get to travel the world. It's getting harder to travel the world. It's getting harder to hire Americans in the developing world, where most of us are really trying to work with local communities. Remember, people will think you've lost your mind. And finally, I always
try to remember that when it comes to building something of value, no just means not now.
Thank you so much, Robin. And thank you to all of our panelists. As you heard, they have such a wealth of expertise and guidance to share with you today. Now we'll proceed with the question and answer session. And as mentioned, we received questions in advance from you, our audience members, by Monday's deadline. If you have additional questions, please post them in the text box on the left of your webinar screen, and we'll include some of those questions in the queue as well. For our first question for Jordan, if you had the luxury of starting over again, what would you do differently in your training and career trajectory?
Sure. I mean, listening to these incredible panelists reminds me of one thing that not that I regret, but a different way that is interesting to go, and that is to do something a little bit different at the beginning. I think that private sector, so to speak, experience that some of these panelists have is extremely valuable. I went right into the nonprofit sector and soon found the organization that I have that passion for, and I don't regret it at all, but it is one way of going and one way of doing things. And when you work in multi-different sectors, it really helps you get a broader vision. And this is something I had to figure out how to adjust for later by networking and getting in touch with a lot of different people and gaining experience through mentorship and through conferences and through programs that allowed me to see how the rest of the sector worked and how different industries worked. But I think it's very valuable to get a diverse range of experience as you're starting out. I think one of the things that's underrated in this sector, in social entrepreneurship, and in the global health field are kind of hard business skills. People don't realize, I think, when you're going into this, how much depends upon your HR policies when you're running an organization. I think one of our panelists is a lawyer. We deal with legal issues all the time, and the more legal knowledge that's within your organization helps a great deal. And I think often this sector is separated from those hard skills when we talk about it, because when we talk about it, we talk about the success stories and the wonderful things and the impact that all these organizations are having. But a lot of all of our days are spent on very serious issues, on issues that have to do with running a business, on issues that have to do with staff, with HR issues, with ensuring that we build careers for the people that work for us and with us. So I think a diverse range of do at the beginning of your career before you find that great organization you have the full passion for is highly valuable. And then I would say at the beginning of your career, seek out a mentor or multiple mentors and network and be aggressive about it. I think it's easier than you think to get to people who you really respect and those who you think are doing great work. They may not hire you, but I think if you are persistent with most, you can get at least a little slice of their time and gain some real insight. And I think that, if I had known this when I was first starting out, I may have done that a little bit differently and gone after some of the people I really respect, but I just thought they were unreachable. But I think what you'll find is that they're human beings and they remember coming up and they'd find a little time to help you out. So it's really about networking and aggressively seeking out that guidance. When I say aggressively, I mean politely and diplomatically and all that, but with a passion and with some persistence.
Excellent insight. Thank you, Jordan. And Andrea, are there issues emerging in global health that we aren't discussing today, but we will likely be talking about in 5 to 10 years? What skills do you think will be key in public health over the next few decades?
Well, I think that one of the things that's really overlooked at the moment in global health are some of the really very, very practical how-to issues. from the point of view of Riders for Health, of course, we deal with, what I've always referred to as the sort of oily hands part of global health. It's not the white coat and stethoscope, it's overalls and some oily hands. But, I think that one of the tragedies about global health is that so many people come from a developed world situation and hope to develop in the developing world a mirror image of what they are used to, and so and that's not feasible because the infrastructure in rural Africa, for example, is incredibly challenging. So you're looking at very few roads. You're looking at no kind of physical infrastructure, and of course, even in terms of new technology, it's still very challenging because there are you don't get the networks and platforms often in rural Africa, or even any kind of network. So some of the assumptions that you make about what your experience is can be seriously undermined and challenged when you are trying to do work in those settings. So I think if there's anything that needs to be done, not necessarily what is being thought about in 5 to 10 years' time, but how it's being thought about, because that setting is going to move very fast, but there's always going to be pockets and isolated areas where things don't move fast, and try to think about, try and forget all this. There's a lot in what everybody has said in this, but I know that what Robin is saying is that you really have to try and see things differently and not forget about a lot of your assumptions and try and put in place, see it very clearly for what it is, and try and put in place what is necessary together with local people, and take your guidance from them, and not try to impose something that you think is the right thing, but just work together with local people, trying to forget what you know, but almost being a conduit, if you like, for knowledge to join with the local knowledge. It is tough, but it is a very there are going to be so many global health developments, but it's so much, for me, it seems as if it's about the how rather than the what.
Terrific. Thank you so much, Andrea. And our next question is for Fola. On the path to becoming a professional, there always seems to be a next step. For a doctor, it includes undergraduate medical school, residency, landing the best job possible, and proceeding as a physician. At what point along your series of steps did you make the decision to pursue a different next step, or did the opportunity just come to you?
I think for me, I was in a bit of a unique situation. I had exposure to global health pretty early in life, mostly just following a parent around who was engaged in what we used to call medical mission work. And it struck me as something that I wanted to do at some point in my life. I just wasn't quite sure how to fit it in. And I went a pretty traditional track. I did my undergrad degree. I went to medical school and residency. I even ended up doing a specialty training fellowship. But throughout all of those experiences, I was able to sprinkle in some global health opportunities, whether it was taking short trips and doing global health education or actually doing clinical care. I was also able to do a master's program where I was able to learn about health system infrastructure globally. And it wasn't really until sometime in residency, so after my medical school training, where it became clear to me that this path would be one of the main paths in my life, and it would give me the opportunity to do something alternative. Around that time, fortunately, I was able to meet some other individuals who, like me, felt a calling to work in this space and who had a very different vision for how to deliver health care globally. Again, moving away from this concept of fly in, provide care for a week in a medical mission, and then disappear completely, and moving towards a concept of sustainable health interventions. And I was fortunate to be in an environment that cultivated and fostered that. We worked with our main mentor, who was Paul Farmer at the time, to develop programs where we would have a sustainable impact at medical schools in East and West Africa. And eventually that just kind of took over. I think in life, when you find something that you're passionate about and you're able to find ways to effectively expend energy in those directions, it eventually starts taking over your life, I think, in a good way, so that you can kind of refocus all your efforts in that direction. And that's pretty much how it happened for me.
Excellent. Thank you so much. And Barrett, do you have additional thoughts on this question from your perspective as being previously a litigation attorney and following the steps to becoming a lawyer before then pursuing One Acre Fund?
Sure. So I'd have to say I'm one of many lawyers who just kind of fell into it as seemed what was a natural step after college. And I did that for about 10 years, but spent a lot of time on the side volunteering for different nonprofit boards, different nonprofit organizations, and because I knew I wanted to make a difference. And then when I was able to do that, I actually laid out a plan. It took me about 2 years to really start networking into the space and really learning as much as I possibly could about all different types of nonprofit opportunities, and quickly focused on small organizations that were taking a business approach to help solve big problems. So just through kind of hardcore networking, meeting people, taking some classes, doing volunteer work, it kind of led me to One Acre Fund. So a lot of mine was luck. There was definitely some deliberate planning, but I was truly a career changer, which can be difficult, but if you have the time, the effort, the plan, you can certainly make it work for sure. And as one of the other panelists mentioned, having a specific skill like legal skill, that is valuable. It is helpful. It helps me every day. Helps me solve problems that otherwise wouldn't be fixed. Helps me find free lawyers to do free work and things like that. So it is a benefit to have the hard skill switching over.
Wonderful. Thank you so much. And Jordan, oftentimes medical missions and other short-term interventions such as voluntourism, brigades, orphanage visits, etc., are seen as examples of global health and international development, whereas in reality they rarely work with local healthcare and education systems and instead undermine the local infrastructures. When these are included on resumes and in cover letters, it provides responsible and quality employers with a clear indication that the applicant does not understand quality and locally responsible solutions. How can students and professionals be involved in global health and international development in meaningful ways from the onset, such as working within local infrastructures? And how can university advisors best advise their students to avoid well-intentioned but ill-conceived programs?
Sure. I think it's a very good question because it's a bit of a tricky road. I think that the first general advice I'd give if you're a student or a recently graduated student looking to get involved in a program, to put it through some simple tests. When you read or look at the approach that the organization is taking, I would kind of filter yourself through it. So if you had a problem or you were disadvantaged, would you want these services? Are these the services that would truly help you, or let's say your children or your nieces and nephews? When you think about if they ever had a problem, what you would want to do for them. And if the solutions seem at face value maybe a little bit flimsy or not deep enough or not connected to the local context in a way that you would want, I think that's a first sign that maybe this program isn't what it should be. Then if you're looking to get a deeper understanding of the programs and understand what they look like and how they work, I think one thing to do is to try to request an informational interview with somebody in the organization, and you often can get access to that, and do a little digging. I think people would be more candid than you might think, and I think you can ask some challenging questions. And I think when you're looking at these types of organizations, what you want to look for, and our other panelists really touched on it, is local understanding. Does it seem like the organization or approach in question truly has a local connection, or does this feel like an outside solution that looks like it's being spread around without a lot of thought of the local context? And I think you need to look at that. I think organizations will judge you on that, on kind of where you've been before. And I think if maybe you do end up in a program or an intervention where you end up feeling that it's not effective, when you do put it on your resume, put something in the cover letter of your analysis of it. I think it's okay to work for an organization and to learn from their mistakes, and all of us make mistakes. There are no perfect organizations, and I think if I saw a resume that had a cover letter where, hey, they worked for a intervention or a service that they didn't feel was full quality, but if they analyzed it and told me why, I'd actually be impressed. So I think you have to do some digging. I think you have a responsibility to check out the organization as much as possible in advance. But I think if you're looking to see what the person hiring is going to think, they want to see really an analysis and a critical point of view from the person. I think that's the most impressive thing, rather than necessarily what they could be associated with.
Terrific. Thank you so much, Jordan. And Betsy, most colleges do not have a public health major. Is a public health major or past public health classes necessary to enter the field? How should undergraduates interested in global health best prepare during college?
Thank you. I would agree with you that most colleges, many of the best colleges, do not have undergraduate majors in public health. And I think that actually is not a problem at all. Just as many of the other speakers have highlighted, there are a lot of general skills, thinking skills, oral expression skills, knowing oneself. Somebody highlighted that. Being able to be analytic and maybe critical about evidence you see, and creative about new programs and interventions that can be designed. These are all talents and skills that emerge through one's college career with all kinds of experiences, from athletics to extracurriculars to classes in whatever topic seems to capture one's imagination. So the actual technical skills of public health are probably skills that, at least in the beginning of a career, can be very much cemented on the job, and then at some point subsequently going back for a graduate degree in public health or global health. I would say, while one is an undergraduate, to open up this career, some of the skills that are particularly useful, and others may feel differently, taking an anthropology course once or twice is terrific to get more of a sense of how individuals are embedded in their larger family and societal systems, and something about culture and health and how those work together. I think a statistics or epidemiologic course where one has to use data to analyze, are things getting better or worse, how do I measure associations between two variables, those are technical skills that can be very useful and really prompt a lot of monitoring and evaluation work, which new graduates get picked up to do. And the last one that I would pick is probably something in economics. Not that one is going to be a end-all, be-all. Economics is going to be the number one issue, but I think knowing something about economic thinking, particularly the way people frame problems when they're using economic thinking, and being able to evaluate that critically is also a skill that I would try to absorb, and can be absorbed in lots of different ways. And again, definitely not needed to be a major in public health to get into this field.
Fantastic. Thank you, Betsy. And Layla, for those interested in pursuing an advanced degree, what is the best way to identify the type of program and type of degree that will provide the best skills and background for a career in global health?
Sure. Yeah, I think it really depends on what someone wants to do in public health or global health. For me personally, the reflection that I had when I was working at UNDP was I was really amazed by the quality and expertise of professionals in different subject matters. So I felt like there was already quite a lot of people with deep expertise in specific components, whether it's maternal health or sanitation or whatever the subject matter expertise would be. So what I thought I could do would be to try and contribute to running more efficient and effective organizations, and that's why I pursued a Master of Public Administration, which is like an MBA but for the public sector. That's just my personal story, but I think if someone wants to focus on high-level evaluations for global health, then perhaps a degree, an MPH with a specialty in epidemiology or even a PhD in biostats or epidemiology could be really useful. If someone's really interested in maternal and child health, maybe a midwifery program. So basically just identifying what component of the field is most of interest and what skills would best align. Another thing to consider might be if someone wants to have a regional focus in their work, then obviously choosing a graduate program that would provide very strong language skills would be important. And then lastly, just thinking about if someone wants to work directly in the field and providing sort of a more direct service role, maybe doing a nursing role or an MPH focused on whatever specific aspect of service delivery you might want to focus on. Or if you're more interested in the management and administrative side of the field, then definitely an MBA or an MPA could be useful. I think it was Jordan who mentioned that hard business skills are sometimes overlooked, and I think I would definitely agree with that. There's so many bright people with fantastic ideas, and something that's of interest to me personally is just how do we get these great ideas implemented in efficient and effective ways, and that can be an aspect of the field of global health that can be really strongly benefit from business skills or administrative skills in just running an organization and managing people effectively.
Terrific. Thank you so much. And Betsy, for current college students, do you suggest that they first pursue a job in global health, or should they first pursue an advanced degree? And what is the best way to gain quality experience and to make a valuable contribution out of college?
I get asked this a lot, and I think there is no one answer. It depends a lot on the student and what they're bringing to that decision. For instance, many students, although as sophomores or juniors feel as if they could stay in school easily for their graduate degree, just going straight on, by the time they're in the first year of their graduate degree, they are completely burnt out and they really want to go to work. And so it is tough to anticipate ahead of time, are you going to be the student who actually does have that much left in them to sit in class and do book work, maybe with some internships punctuating your academic work, but will you be okay with that, or will you really get antsy and need to work? I think the average student should work first. You do have the exceptions that are just, they want to go through the academics and they're prepared, but I think on average, the modal, I would recommend a student get work experience. I think by the time they come back to graduate school with the work experience, they just can underscore the graduate school that much better. It kind of multiplies the effect of the graduate education. In terms of what to do and how to have a meaningful experience in the field, others have recognized this, and I agree with them fully. Get a good mentor. Work, whatever you're doing, work for somebody from whom you can learn and who allows you to flourish a bit. And second, I would worry less about making a huge contribution changing the world and more, as someone else said before, developing self-awareness and developing your own capacity to listen, to communicate, to be flexible, to solve problems, your own maturity. I think that's really what the first job is about, and that will be parlayed into a much more impactful job in the subsequent career years.
Terrific. Thank you so much, Betsy. And Tali, what qualities, skills, and characteristics do you look for in people who you hire or accept as fellows?
I love that question. My answer ties back to Jordan's earlier point about the value of bringing people of many different backgrounds to global health work, and in that way adding more types of skill sets to this field. Global Health Corps is bringing a new breed of leaders to the global health space, and part of that work is to make it possible for young professionals, those who have a global health background and those who don't have a global health background, to be able to spend a year working on these issues. So we very intentionally recruit people from the finance and business sectors, lawyers, architects, supply chain professionals, pharmacists, as well as young people straight out of college. And our goal is for them to see just how useful their hard and soft skills are in global health organizations. So what we're looking for in GHC fellows really falls into two buckets. First, fellows have to meet the professional requirements of the positions they're applying to. So applicants can apply to up to 3 positions in 3 different organizations, but they need to meet the requirements spelled out in those job descriptions. And second, probably more important, we're looking for people who have leadership potential. And by that, I mean that they align with a set of leadership practices that we found transformational leaders in global health embody. So we're using the word practice very intentionally here, rather than words like qualities or characteristics, because we believe that these are behaviors that anyone can make a choice to adopt, and that everyone needs to practice because they're not things that you're born great at. These leadership practices are explained in more detail on our website, but they include a commitment to social justice, an ability to adapt and innovate, self-awareness, and a commitment to learning, a lot of the things that have been talked about, an ability to collaborate, an ability to inspire and mobilize others, and the ability to get results. So essentially what we're looking for in applicants is examples of these practices in the applicant's life.
Thank you, Tali. And Robin, for professionals looking to break into the field of public health from a background other than public health, what do you recommend doing to get noticed in a job application? And what are the best strategies for presenting your skills as transferable and your capabilities as useful in the field?
Right. It's a great question, and we do get a lot of applicants, especially when people hear that I didn't come from a traditional background. I think it's really important to break down what public health is. That's a really broad term, and it doesn't say anything about your skills or your interests. So I think first thing, people need to break down what do they want to do, what are they good at? Is it programs? Is it M&E research? Is it operations, communications, fundraising? You don't want to apply for a fundraising job if really what you want to be doing is M&E. It's not good for you. It's not good for the organization. So once you've broken down what it is that you're good at, what that you want to do, then look at the job description and look at your skill sets. So in other words, yes, I came from television, but I was a good writer. I was a good storyteller. I was a good salesperson. These are skills that are transferable to almost any occupation. So if you just match up your skill set with what the job requires, it almost is irrelevant that it's in public health because you're applying for the job. And then I think it was Jordan who said, really do your digging. I mean, when you want to stand out and it is highly competitive, address what that organization is about. Don't have it be a broad, I want to get into public health. Look at what that organization was, where are the gaps in that organization, and how you can fill them. Even if you don't have a huge background in that, how can your skills help this particular organization achieve its goals?
Perfect. Thank you, Robin. And Paul, what is the best way to become involved with innovation and social entrepreneurship while working for a large corporation? And also, what is the best way to successfully pursue intrapreneurship?
Sure. Thanks, Jennifer. So, really good question in terms of getting involved within a large corporation. On one hand, sort of the perception is large corporations have lots of resources, lots of opportunity, which is really true. But the flip side is sometimes there's potential, but if you can't realize it, if you can't tap into it, it can actually be more frustrating. I think one of the most important aspects that I've personally experienced working in large corporations, but as people have said, the importance of passion. My passion for innovation and social entrepreneurship, when I first started, seeking out and seeing what the opportunities were within the company, going some of the traditional channels, at the time, I was working in a strategy role in Europe, and I talked to our corporate philanthropy folks, and it was almost like, thanks for letting us know of your interest, but we've got it covered right now. Don't call us, we'll call you. And, right away, it's sort of like, oh, geez, what am I thinking? I'm going to have to leave the company, if I want to pursue this interest. But, you start looking and knocking on other doors and looking at other opportunities and doing more research. So, I think one of the most important things is that, in this day and age, particularly within corporations, there isn't a particular track, there isn't a particular career path. For example, we have so many people that we have 300,000 employees worldwide. And I tell you, a week doesn't go by, and sometimes not a day, that there isn't someone, dropping an email or calling and saying, oh my God, I've just learned about the work that your group is doing. Do you have any job openings, in your team? And, the answer that I often give is, well, we don't have, an official opening on payroll, but, we consider that within the company, we've got an extended virtual team of 300,000 people. So if you've got the time, if you've got the opportunity, and you want to position this as part of your professional development, as part of your volunteering time, we have more than enough opportunity. So if you're passionate, if you've got sort of the right capabilities and the right attitude, we find the opportunities. So looking at things a little bit more unconventionally rather than, I have to have, the certain job title and a very specific responsibility, formally laid out, be very agile and open to, different approaches. In terms of successfully pursuing intrapreneurship then as well, I think a couple of things. Number one is, intrapreneurship, maybe said a little bit more plainly, is about change. And so, you've got to be comfortable with change, realize that, part of being an entrepreneur is also, provoking for change and doing things in a better way. Some people are very comfortable, again, with title or role or responsibilities or level. And so part of being successful as an entrepreneur is, being able to, to accept and take the risk that, by definition, it's a little bit like innovation. By definition, innovation is about experimenting and being open to failure. If you're not failing, you're not innovating. If you're not sort of sticking your neck out, sort of poking the stick and agitating for change, in both a positive way, then you're not really being an entrepreneur. You're not really driving change. So, knowing that, if you leap, you can fall and you can get hurt, but you pick yourself up and you try again. Another really important aspect to entrepreneurship, or just being successful in social innovation in general, is again, I think being very open, to the skills, the passions, the opportunity to work with others who complement your own skills and passions. It's sort of the better together, 1 + 1 = 3, and it multiplies from there. So, being very flexible and very open, to different forms of collaboration as well.
Terrific. Thank you so much, Paul. And for our last question for Tali, in general, do you see specific skills that typical young global health professionals are lacking? What skills are especially beneficial for students and young professionals to focus on? And what type of unique skill sets can be especially beneficial to the global health field?
Sure. One of the things that I really appreciate about the global health field is that it is so broad, and there are roles for people with a lot of different skill sets, as has been talked about a lot on this call. So we need project managers, we need people to do monitoring and evaluation, we need supply chain people, we need finance people. So I think that there are many unique skill sets that are valuable in this work. What I've found to be very effective is when young people can pair their job function content knowledge with an ability to problem solve and follow projects through to completion. I think that of our fellows, I think they bring a lot of new ideas and innovative thinking to their placement organizations, and the ones that seem to have the best fellowship experiences are the ones who bring excitement about their projects, generate a lot of good ideas, and then they get really creative about how to solve the problems that begin to arise. I think because global health is such a multidisciplinary field and people's health is impacted by so many other parts of their life, like their housing, air quality, transportation, food, the ability to creatively address and overcome different types of obstacles and bring projects to completion is especially valuable in global health.
Wonderful. Thank you so much, Tali, and thank you to all of our phenomenal panelists and all of the incredible expertise and guidance and advice that you have shared today. This brings us to the conclusion of today's webinar. Thank you.
Thank you.
Thank you very much.
Good luck, everyone.
And you, bye.
Bye.